Hello, I am Dr. Joey Tapia Fusile. I am an assistant professor at the University of Colorado, Colorado Springs, and I'm here to talk to you about our paper, Emotionally Focused Therapist Experiences, Serving Interabled Couples in Couple Therapy and Interpretive Phenomenological Analysis. Our study had 10 participants, all emotionally focused therapists, so EFT trained, certified, and majority of the sample were supervisors as well in EFT. And so across all 10 participants, we examined their experiences and what it was like to serve interabled couples and relationships. Interabled couples, just to clarify, it's not a catch-all term. It's not meant to capture everybody. It is a term meant to capture an experience, and for some it may fit, for some relationships it might not fit. And so it's so important that that is considered as you read this paper, as you watch this video, is it's not meant to be everyone fits under this umbrella. And interabled is where one partner is disabled and one partner is non-disabled. And so that kind of just highlights the differences. Part of the study was examining partners with physical disabilities and how within relationship and how therapists navigated serving them through an evidence-based model for relationships. And through the study, some key takeaways. One of my first theme that came from the study was around ableism. It is so important to understand ableism as a force has found its way into our fields of the helping profession and how that has influenced what we do and how we do it. Many of the ways in which ableism came up in the study from participants was from a deficit-oriented lens and how they talked about disability. And it's interesting, and when I looked at accreditation bodies across marriage and family, psychology, clinical mental health, and social work, it all clearly describes clear standards around needing to train clinicians to be culturally responsive or competent. But when it came around disability concepts, that often was lacking. And so that ableism itself influenced the decisions of therapists as they continue to work with them. Many of them experienced insecurities around disability, didn't know how to approach it, didn't know how to bring it into conversation, and that impacted what they did next. And so it really spoke to a need to be more disability responsive. We are working in so many ways to be culturally responsive, but I think, a real highlight of the study was how do we situate ourselves to be disability responsive, to meet them where they are within the relationship and in a way that is not ableist, not deficit oriented. That's true to EFT. It's a strength-based approach. How do we incorporate that to the work that we're doing? Other things that came were how we situate ourselves as clinicians and communities. And so how we advertise ourselves, what do we include in those advertisements and or websites? Do we explicitly name that we are accessible? How are we accessible? Do we have a ramp? How big are our doorways? Are our office space adjustable? All of those things often aren't listed anywhere. And so these folks, these interabled relationships have to kind of seek that out, ask extra questions that might be more inclusive if we just had that available immediately. And so some of those are lovely takeaways and that we will continue to pursue. And there's so much that came from this, and I hope you will find some meaningful parts that really land with you. And I really want you to sit with this. If you're watching this, if you're going to read this article, really sit with how ableism situates itself within your practice, within your experience. Thank you so much. Bye-bye.